Good day, Dr. Meti here. In my previous video, I asked some few questions concerning why we are not able to deliver relevant services, much needed services through telemedicine across Ghana. I posed questions such as what could possibly be the reasons why we are not able to deliver much needed care through telemedicine in your practice as a doctor, wherever you are. How many times have you consulted your cases exclusively using telemedicine applications? And what challenges did you face? How many patients have, for instance, spoken to you and shared their experience on the usage of telemedicine? So those were general questions I asked concerning the previous video without making any attempts to offer any solutions. We were just brainstorming. Today, I just want to take a second look about at the specifics, the specific challenges that bedevils the delivery of services via the telemedicine approach. I got some few points. First is the limited access to technology. According to the World Bank, as far back as 2022, it's only about 39.3% of Africans had access to the internet compared to the global average of 59.5%. So that's on the low side. From 2020 to 2024, that's 4 years. I believe possibly the numbers must have appreciated because today internet is used for a lot of the things around us. Now again, I think there is varying complexities with regards to the role of tech in delivering healthcare services via telemedicine. We have the audio, we have the video, or both. We have recorded audio, recorded video. We have synchronous consultation where you get to speak to a doctor in real time. Then we also have the asynchronous consult. And I think if it's possible to look at the individual challenges, it's very possible to break it down to components such that the low tech is assigned to people with minimum access to technology. Because just as people are able to send money using their low-tech mobile phones, you don't even need a smartphone to be able to send money across the telecommunication companies to family and friends. And so it's very possible for such technology to be harnessed to deliver healthcare services. We don't all need internet access to power the tools or the services that can help us deliver healthcare services. But I must agree that where there's a need to deliver video, audio in real time, then internet access becomes a very powerful tool. All right. But that being said, I still think just as people are able to pick a phone call and call a doctor friend or a pharmacist and ask relevant questions about a drug or a first aid, and they can act on that information and get well without sometimes having to go to hospital or doing any major follow-up, it can be well packaged so that patients can access this health. So that even if you had a smartphone, you should be able to access the services of a doctor via telemedicine. And if you had a smartphone or if you had the low-tech gadgets, what you call YAM in this country, the YAM phones, you still should be able to get access to a healthcare worker via telemedicine. So essentially what I'm trying to say is that we should not make limited access to technology become a universal problem, but we can, through the experts, break down the individual complexities of access to technology so that simple solutions using simple tech is made available to those with limited access to, let's say, internet. And then services that needs to be powered by the net is also made available to those who have access to the internet. And then with that, we give everybody a fair opportunity to access health. Now, digital literacy is also another challenge that has bedeviled the success of delivering services via the telemedicine apps. And with digital literacy, for instance, if you have a nice app, let's say Google Apps, and if anybody went to Google Store and downloaded an app but found it difficult to get around it, that's for those who are even tech savvy, that it can be understood that it will be far more difficult for those with limited knowledge in negotiating the apps in terms of functions to be able to use it to their advantage. But for the few telemedicine apps I've seen, you need to be able to log in your details accurately. There are portions where you select your doctor based on your conditions, how to access pharmacies near you, labs near you. Some of them fall to the end user, that's the patient, to be able to make um, to select those services. Others, it is usually the app managers who facilitate delivery of these services. So digital literacy, yes, is a challenge, but I think that just as we've been able to get TikTok everywhere, Facebook everywhere, WhatsApp, average Joes are able to use WhatsApp, TikTok, Facebook, Instagrams without a hitch. So I think we should take a second look at how we can retool the technology and make it easily accessible for everybody. The third point is about regulatory and legal barriers. Doctors feel they might get sued if they made mistakes. It's a genuine fear, but that fear is not dealt with if you consult in person at your hospital. You can make mistakes, can equally get sued for unprofessional behavior. So I think that it's a matter of taking a holistic look at permissible practices, if I'm to put it that way, what can be allowed through telemedicine? How do we get around the legal framework? How does the patient get protected, the interest of the patient, and all that? And with that, we should be able to get around the various loops, because I don't think that if you work in a regular hospital or a clinic or office practice, much as it is face to face, if you misconduct yourself today, you can be sued at any time. So, in the same way, if you consulted a patient online, and of course, the patient must be adequately informed about your education, your level of competence, and all this is it behoves on the app managers and the owners of the telemedicine companies to ensure that the doctors they put on the platform have the necessary qualification to deliver the necessary services to the client so that the interest of the client is protected. So I don't think that the fact that you consult somebody online gives you any protection from the long arms of the law if you fall short of the tenets of good practice. There is also the challenge of reimbursement. And I've come to make this critical observation that anytime you consult patients online, is it by phone, video link, or whatever, it's generally considered to be free service. Few times I have had to consult patients via video link, and afterwards, I don't think the patients appreciated, not that they didn't appreciate the service, but they didn't understand why they should pay, because they didn't travel across time and space. You are sitting behind the comfort of your desk and listening to somebody. People don't usually put a premium on that. So, because of that, I think doctors are reluctant to render that service. They would rather you come to the clinic or hospital where they work so you can pay for the service and have face to face consultation. But let's compare to technology such as what it takes to send money to relatives, friends. Currently, we are paying tax on that. It's not free. If you make transfers from one bank to the other, you pay interbank transfers. If you send money from Ghana to other countries, you pay charges. So if patients are ready, the general citizenry is ready to accept to pay for these services, which very much depends on complex technology, then why not pay for healthcare? So I think there is some microcultural tweaking that we need to deal with for patients to appreciate the value they place on online services. Because it's only then that doctors will come on board. I doubt doctors will be willing to render free services. Those in government will just work their usual shifts in government hospitals or clinics and go home and would want nothing to do with the patients. Who would not be willing to share their contacts whatsoever. if it's not going to be a paid service. So we need to find a middle ground for that. People have raised concerns about the quality of care. How best can you take care of a patient that you don't get to touch? Yes, you can take a very good history face to face via video link. No, it's not face to face, via video link or via audio. But then when it comes to physical examination, you are limited. Patients have attempted to get around this by taking pictures or doing a short video of part of their body that is the source of the problem. So, for instance, if you, let's say, had a hernia and this is big enough and obvious, spot diagnosis, any clinician would know that that is a hernia. And so, whether it's a video or a picture sent to the doctor, it's enough to make that diagnosis. But assuming it is a mass coming from, let's say, the back or the hip or a part of the body like, let's say, the vagina, that requires that you use some form of retraction in order to be able to see very well and physically examine and make a good diagnosis. Then, of course, you are going to be limited. But again, this is not about perfection. It's about progress. So if where the telemedicine is limiting, then progress should be made and an arrangement done for the patient to be seen one-on-one. But at least the progress will be far better because then you are even pre-informed before you even see the patient one-on-one. As compared to not knowing the patient at all, and the patient may be living with his condition and never gain access to the facility because of the aforementioned problem in the previous video about waiting time and the like. So I think with the quality of care, we can rather look at possible ways by which we can deliver the service via the limitation, considering the limitations of the online platform or audio platform or video platform or whatever the telemedicine app seeks to use. Rather than think that because we cannot, for instance, deliver an IV via telemedicine, or you cannot do an oral or rectal or vaginal examination, then it becomes a challenge so much that telemedicine should be discredited. I don't think that is good enough of an excuse. And again, progress when it comes to quality of care is better than perfection, because even in person to face consults with a patient, you still don't get to. It's not a perfect system. Some things may be overlooked. You might forget to evaluate a patient until subsequent visits. You may miss to order certain labs. Patient might even forget certain complaints and may not communicate it at all. So again, telemedicine should be seen as a tool to complement and in some situations become a substitute. Okay. Not good enough substitute, but the better substitute compared to zero care, so that patients are not left unattended to, especially the vulnerable and those who are in resource limited areas. The quality of care also moves with the scope of services. For instance, if you had a patient came to a hospital with well-established labs, radiology units, wards, theater, it's readily understood that the care will be better, for there's wide-ranging services available for the patient, and the doctor is at liberty to see the patient and give holistic care. However, it will be difficult, for instance, knowing the nearest pharmacies, the nearest lab or radiology office where extra services can be sourced. And this can sometimes be limiting. But again, if we are determined to make progress and tweak the system, we can get around these hoops. Some of the apps, I have seen some of the apps they've got a database that tracks nearest pharmacies, nearest labs. So they are able to direct the clients to these areas. But again, it will mean that for those apps, because it's powered by the internet, it will become a limitation for a patient who cannot access the internet. That's why in my earlier submission, I said that we should develop apps of varying complexities so that we can create tailor-made solutions for the clients. We also have the cultural and socioeconomic issues. I mean, culturally, not everybody is comfortable with having to consult a doctor via the phone. Some believe that for you to be attended to and for the care to be optimum, it has to be seen by the doctor. It has to be spoken to by the doctor in person. The patient must be touched by the patient. But let's face it, not every patient can be seen, can be talked to, nor even touched by the patient. There are countless examples. People have gone to teaching hospitals and they were lucky to see the specialist once. And subsequently, the rest, the care was assigned to other doctors lower in the rank, house officers, medical officers, and the like. So it is not practically possible to see a doctor and be touched by a doctor as we would usually want. And one of the frustrating things about patients visiting hospitals is how doctors change. So today they see Dr. A, and next visit, Dr. A is in a different team. Next visit, a house officer or a medical officer is attending to him or her, as the case may be. People get frustrated as to why they can't get access to the same doctor each visit. And so these are things that we should look at. And I think it comes with education. If we educate patients on the need to accept health care from other practitioners who are in the same team because of necessity of continuity of care, I think we should be able to deal with these cultural, social-cultural issues. The last point I'd like to speak to is privacy and security. Patients naturally get anxious about their diagnosis being out there. Who is going to consume their personal data? Is the doctor professional enough to maintain privacy, adequate security of the client's information, health information? Some diagnoses are quite sensitive, and if it were to get out there, the patient may be marginalized in his microenvironment. So that's a genuine concern. How does it compare to the privacy and security issues of established institutions, hospital clinics, and the like? Patient is still vulnerable because you still have to volunteer your personal information, no matter how sensitive this information is, to the facility. And you are trusting the attending clinician to maintain a high sense of professionalism and non-disclosure of your details to even other clinicians. And so, drawing this parallel, I'm only just trying to say that you are not necessarily protected if you fall into the hands of a doctor or a practitioner who decides to take your information and blow it wide. That is even in established hospitals or clinics. And there are countless examples where doctors have been sanctioned for unprofessional behavior, for taking patients' information, and even putting it out online just to gain online traction. So, again, the matters of privacy and security is not a unique challenge to telemedicine. It's a challenge even for face-to-face consultation in well-established hospitals. So, in summary, I think that the very, very challenges that has bedeviled the successful takeoff of companies or apps that seek to deliver telemedicine to a wider community very, very much also exists in face-to-face consultation in established hospitals and clinics worldwide. And so, instead of sweeping or overlooking some of these challenges and getting too comfortable with the traditional snail pace approach of putting everybody on a conveyor belt to come to hospital and go through the rigorum of queuing up and seeing a doctor, going home, coming for review, I think that we should learn to micromanage some of the challenges that have been found in the space of telemedicine, so that with that we can deliver a comprehensive package of healthcare to patients. Let's look at progress instead of perfection. But there are countless number of lives that can be saved if we had a well-structured way of delivering telemedicine to patients. I challenge those in the tech industry, stakeholders, those who have had telemedicine up and running and are running it successfully. Please share your ideas with me. I'm curious. I'm interested as to how we can really get telemedicine to get a significant percentage in terms of doctor-patient interaction. And with that, I think we will be able to deliver better health care for our patients. All right. So leave your comments and questions, and I'll do my best to try and answer. I'm not an expert on this. I'm only here trying to shop for ideas and stimulate the discussion. Thank you.